In New Hampshire, there's 170,000 uninsured. The vast majority of those people are hardworking individuals and families who simply cannot afford health insurance. What Medicaid expansion would do is to provide nearly 60,000 people with insurance coverage, provide primary care and prevention, access to health care to providers to keep them healthy, and that's just the human side of the equation. The economic side of the equation is that there would be $2.5 billion in federal tax dollars coming here to the state over a 7-year period. The federal government would fully fund for the first 3 years 100% of the newly expanded Medicaid expansion and would reduce it only to 90% in every year after that. For a biennium cost here to New Hampshire of $3 million, bringing in $422 million in revenue just in our next biennium. To give you a sense of what $2.5 billion is, $1 billion is $1,000 million. So that's $2,500 million that's coming into the state, and the state needs to come up with $84 million. $84 million is 3% of those resources. So that's a 97-to-3 return on investment. And if we had an infrastructure project in terms of roads and bridges, and we were offered 97 cents on the dollar, we would be all over those resources. And these resources are actually to protect almost 60,000 people in New Hampshire to give them access to health care. We have a chance to bring the greatest statewide economic impact in terms of job creation, income growth, revenue growth, than any initiative ever considered by our elected officials, impacting residents of New Hampshire in every county, in every town, in every House and Senate district. New Hampshire has arrived at an important healthcare crossroad. We can choose a path to healthier, more productive populations through insurance coverage and access to services for low-income, hardworking families, or we can stay on a path that will remain us the status quo of 170,000 people that are uninsured in our state.